So for today's video, I'm gonna be reporting the other mental disorder. So this is a very short discussion since in the DSM-5, there are only 2 pages na makikita doon with regards to this topic. And also, I have searched, I have a lot, with the books given by ma'am, wala talaga siyang discussion ng other mental disorder there. And any other references na nakita ko, parang limited lang talaga yung discussion doon. So, let's get started with it. Okay, so for our intended learning outcome, iisa lang naman yung intended learning outcome natin ngayon. To understand what is the other mental disorder and its specific types. The other specified mental disorder due to another medical condition. The unspecified mental disorder due to another medical condition. The other specified mental disorder. The unspecified mental disorder and no diagnosis or condition. So, yun lang po yung ILO natin ngayon. So, to start with, this discussion focuses only on this concept. The other mental disorder as a whole are symptoms, characteristic of a mental disorder due to another medical condition that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate. But ito na yung kumbaga highlight ng report ko. Other mental disorder do not meet the full criteria for any specific mental disorder attributable to another medical condition. Yun yung highlight ng aking report. The rest of my report, yung 4 na specified other mental disorder na yun, pareha lang sila ng sabihin natin diagnostic criteria. All of that are characteristic ng mental disorder na that could due to another medical condition na nagkukos ng significant distress or impairment sa any dimension ng life natin, social, occupational, or any dimension na of the functioning. Pero, those criteria do not meet the full criteria of any specified mental disorder. For example, yung mga criteria ng depression, ng schizophrenia, ng OCD, di ba may mga diagnostic criteria mo na gina-follow, and pag ma-meet yun lahat siya, of course, madadiagnose na yung person or yung ng individual ng specific mental disorder. Say, kung ma-meet niyo yung criteria ng depression, yun, madadiagnose siya with depression. However, with this, hindi niya fully na-meet yung criteria ng depression. It can be na 2 or 3 criteria lang yung meet and the rest wala na. No symptoms at all, wala na talaga. So, yun yung other mental disorder. Pwede natin yun siyang i-diagnose ng with other mental disorder kasi hindi niya na-meet yung other criteria. So, as I have mentioned, yung other mental disorder may 4 na kumaga specific na disorder. Okay, so first on the list there is the other specified mental disorder due to another medical condition. So as I have mentioned, same lang sila ng description, no? Na this category applies to presentations in which symptoms characteristic of a mental disorder due to another medical condition that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any specific mental disorder attributable to another medical condition. Pero, yung pinagkaiba niya sa the remaining category is that this category is used in situations in which the clinician chooses to communicate this specific reason that the presentation does not meet the criteria for any specific mental disorder attributable to another medical condition. So, kumbaga, si attending physician is he or she chooses to communicate the specific reason kung ano ba yung reason na si distressed individual is hindi siya pwedeng i-diagnose with schiz, hindi siya pwedeng i-diagnose with OCD, hindi siya pwedeng i-diagnose with depression kasi nga hindi yan na-meet yung full criteria ng any specific mental disorder. Yun. So, for example, example dito is presentation that can be specified using the other specified designation is the following. So, for example, dissociative symptoms. This includes symptoms occurring, for example, in the context of complex partial seizures. There. So, in other words, yung other specified mental disorders due to another medical condition is yung person is experiencing symptoms, pero those symptoms do not meet any of the criteria for a specific mental disorder. However, the clinician chooses to communicate the specific reason. Kaya naging specified mental disorder siya, another specified mental disorder siya. Yung kaibahan niya naman is yung another unspecified mental disorder due to another medical condition. Yung pinagkaiba niya naman is the clinician chooses to not specify the reason that the criteria are not met for a specific mental disorder due to another medical condition. And may end pa, includes presentations for which there is insufficient information to make a more specific diagnosis. Ito naman sa unspecified mental disorder due to another medical condition, the clinician chooses not to specify the reason. Hindi niya gi-specify yung reason. Yung sa isa, yung sa other specified mental disorder, gi-specify ni clinician. Gi-communicate niya sa family or sa distressed individual mismo na yung specific reasons bakit hindi siya pwedeng i-diagnose with a specific mental disorder kasi nga hindi niya na-meet yung mga criteria. Whereas dito sa unspecified mental disorder due to another medical condition, hindi gi-specify ni clinician yung reason na kung bakit hindi na-meet ni distressed individual yung mga criteria. And also, yung mga manifestations, yung mga presentations niya is kulang, insufficient yung information niya, kulang na kulang yung information na binibigay or nabigay or yung ginamanifest ng distressed individual para mag-diagnose siya ng another another specific mental disorder or yung may or para makapagbigay si clinician ng specific diagnosis, kulang yung information na ibinigay ni distressed individual. Another category in the other mental disorder is the other specified mental disorder. Still, yung sabihin natin na diagnostic criteria or yung pamantayan para ma-diagnose ka ng ganito is that pareho pa rin ng mga nauna. Yung pinagkaiba nga lang is this category is used in situations in which the clinician chooses to communicate the specific reason that the presentation does not meet the criteria for any specific mental disorder. Now, in the DSM-5, wala itong section na ito, itong no diagnosis or condition. However, DSM-5-TR, if makafollow kayo sa aking reporting, is mayroon ng additional na no diagnosis or condition. Ito naman, simple lang. When the person has been evaluated and it is determined that no mental disorder or condition is present. So, pasalamat ka if ito yung diagnosis mo, na no diagnosis ka or no condition ka kasi you are evaluated by the clinician that you have no mental or disorder or condition. Siguro ano lang 'yan, yung mga ginamanifest na symptoms natural lang 'yan. Hindi pa 'yan siya ma-diagnose or hindi pa yan kulang pa yan siya. I mean not kulang pero hindi pa yan siya enough to diagnose a specific mental disorder. And wala ka talagang wala talagang diagnosis kasi okay ka, you are functioning well, you are okay. Okay, now. Okay, so I have here an example, a case scenario na pwede natin ma-relate sa other specified mental disorder due to another medical condition and unspecified mental disorder due to another medical condition. So, for instance, Miller is diagnosed with HIV/AIDS. For the past 2 weeks, he is feeling hopeless, has lost interest in doing anything, having significant weight loss, and he is experiencing insomnia. He went to a doctor for a checkup, but he was referred to the psychologist. Now, the clinician is um the clinician, of course, malalaman niya na si Miller ay may HIV/AIDS, of course, 'di ba? And then, sasabihin din ni Miller yung mga nararamdaman niya. Now, upon checking, the clinician or the psychologist would notice na yung tatlong dinulog ni Miller na hopeless siya, nawawalan ng interest gumawa or wala siyang motivation, ganon, or and apat pala ito and nagkakaroon ng weight loss siya, and then nagkakaroon siya ng insomnia, ay palatandaan or isa ito sa mga criteria, if I'm not mistaken, under depressive disorders, sa major depressive disorders, MDD. However, yung problema dito is apat lang yung na-experience ni Miller ng mga criteria. Apat lang. And check naman na for the past 2 weeks, consequently niya na nararanasan yung apat na yon. So, hindi siya na-meet, hindi na-meet yung mga na-experience ni Miller na criteria para ma-conclude or ma-diagnose siya ng doktor, ng clinician na mayroon siyang MDD. Okay, now, sa clinician nasa clinician ng decision whether or not i-disclose niya, i-communicate niya kay Miller yung reason na hindi siya pwede diagnose with MDD. It can be also na kulang din yung mga gi-disclose ni Miller or kulang yung gi-share ni Miller na mga symptoms para makadiagnose pa si clinician ng another specific mental disorder. So, it's either yung diagnosis ni clinician or ni psychologist mag-fall siya under other specified mental disorder due to another medical condition or unspecified mental disorder due to another medical condition. It's either nasa dalawa lang yun. Nakadepende na yun siya kay psychologist, kay clinician. Okay. So, I have here another case scenario na pwede natin ma-relate sa the remaining two, yung other two na category under the other mental disorder, which is the other specified mental disorder and unspecified mental disorder. So, Robert went to a psychologist to ask for help. For the past month, he feels agitated, he can't sleep, and sometimes hallucinates, and he's having mood swings. Now, itong mga symptoms ni Robert is hindi niya na-meet ang criteria for any other specific mental disorder. Kasi pwede siya i-diagnose with schiz, pwede siya i-diagnose with depression, pwede siya i-diagnose with say catatonia, pwede siya i-diagnose with eating disorder, ganon. Pero, hindi pwede. Kasi, hindi niya na-meet full ang criteria, hindi niya na-meet ang full criteria. Although, nararanasan ni Robert ito for the past month. So, matagal-tagal na. However, as I have mentioned, hindi siya ma-diagnose ni clinician na ganon kasi nga, any of the specific mental disorder hindi na-meet or wala na-meet yung mga gi-manifest ni Robert. So, the clinician will either diagnose him with other specified mental disorder or unspecified mental disorder. If yung mga gi-disclose din ni Robert is kulang din, yung other gi-disclose ni Robert is kulang din para makamake din ng more specific diagnosis si clinician natin. Okay, so to have a more broader understanding at least, I will present to you two research about the other mental disorder. So, I've tried my best to find materials or researches on the other mental disorder. However, masyadong limited yung study na gi-conduct with regards to my topic. And kung meron man na is parang binibenta siya ba for sale siya, hindi ko siya ma-acquire. So ito lang yung nakita ko. Okay, so first is that in the research by Botel et al. 2022 entitled The Quality of Life of Internet Use Disorder with and Without Comorbid Mental Disorder, they found out that male IUD patients showed a significantly lower QOL or quality of life compared to age-matched healthy men, supporting the clinical relevance of IUD. Furthermore, IUD or internet use disorder patients with additional comorbid mental disorders even reported lower quality of life than comparable non-IUD patients with other mental disorders. Depressive symptoms were a significant predictor of low quality of life in IUD patients. Strategies to reduce depressive symptoms should therefore be considered in treatment of IUD patients to improve the quality of life. Okay. So, ibig sabihin daw nito is that yung mga patients with internet use disorder are reported as they're reported for having a lower quality of life compared to the non-IUD patients with other mental disorders. So, kumbaga, yung mga may internet use disorder patients na and may other mental disorders pa sila have a lower quality of life compared sa mga non-IUD patients pero may other mental disorders. Yung other mental disorders na specify dito is yung may depression, may anxiety, ganon, or other mental disorders. Although yung research na ito is focused on the quality of life experience by the internet use disorder patients with and without comorbid mental disorder or may other mental disorder. So, they concluded in their study that patients with internet use disorders and other mental disorder have low quality of life. Kumbaga, mababa yung quality of life nila, parang they feel hopeless, ganon. So another study I have researched about is the study of Agabio and Legio on 2018 entitled The Baclofen in the Treatment of Patients with Alcohol Use Disorder and Other Mental Disorders. Okay, they found out that the presence of other mental disorders such as anxiety and depression other than the AUD rather, represents a frequent and complex clinical phenomenon. The use of baclofen as a pharmacological treatment of AUD patients with other mental disorders represents a significant challenge. Bakit daw? Kasi baclofen is parang ano siya, um, medicinal medicinal ano tawag nito? Um, it's a medicinal treatment, okay? And then parang yung uh, goal ng study ng Agabio and Ligio is if effective ba yung baclofen to treat patients with AUD or alcohol use disorder and other mental disorders. So parang yung mga participants sa study nila is mga patients with AUD and other mental disorders. Yung other mental disorders naman nag-specify doon is still depression, anxiety, ganon. And then, their study had found out na mahirap or mahirap siya i-treat yung patients using baclofen sa mga patients with AUD patients and the other mental disorder. So, baclofen can be used to AUD patients and to AUD patients with anxiety or with depression. Kumbaga, two mental disorders kaya pa. Pero pag 3 or more na daw, parang significant challenge na mahirap na siya i-treat. So, yung conclusion nila doon is that parang there should be a limitation to the use of the baclofen as well as parang may silang suggestions in the medical field that would limit and would um, control the use of baclofen kasi there are also negative and adverse effect of using baclofen sa katawan ng tao. There. So that ends my report and these are my references. So if ever you have questions, clarifications, corrections on my report, please don't hesitate to PM me or ask me so that pwede ko siyang masagot and pwede ko siyang makorrect. And that would be all. Thank you and good day.